Minimally invasive sinus surgery is a group of procedures where we are being relatively conservative compared to big operations done in the operating theatre, whilst still being effective and doing smaller procedures that can solve various problems in the nose. And there's a whole raft of different conditions that can be good candidates for minimally invasive surgery. Uh, what I actually started off with, which was the first procedures I was doing, that was operations on what's called the inferior turbinate of the nose. So some patients, when they get a feeling of nasal congestion, often alternating from side to side, the primary problem is to do with swelling of this inferior turbinate, which is part of the lining of the nose. And a relatively straightforward procedure using a particular device to shrink the lining can be done under local anesthetic, and it's minimally invasive. So, one of the key aspects of minimally invasive surgery is that it doesn't require a full general anesthetic. The vast majority just require local anesthetic, and a small number of patients, I also provide them with some sedation. That just makes them a little bit sleepy, removes any anxiety. And also, what can be quite helpful is that patients don't always remember what's happened during the procedure if they've had sedation. So even if it was a little bit uncomfortable, they've forgotten it, and they can just move on and recover. And the sedation is actually given by me without the use of an anaesthetist, and it's very light and simple. The patient's still awake, but just a little bit sleepy. So I've talked about turbinate surgery, which was how I started, and I then move on to more sinus, more slightly more involved procedures. And another example of this is nasal polyps. So nasal polyps can be quite difficult to manage. They often grow back, and they are part and parcel for many patients who have sinusitis. And sometimes they need a big operation under general anesthetic in the operating room. But in certain cases, particularly in the slightly older group of patients, then a minimally invasive, fully awake operation where I can remove the vast majority of the polyps can be very effective. They don't have a long hospital stay, and they can be home within a couple of hours. And then they can sort of get back to normal, and also it avoids all the risks of having a general anesthetic and everything that goes with that, plus all the time. So any operation requiring full anesthetic in an operating theatre requires a pre-assessment, sometimes stopping some medication, and then they're in hospital for many hours, if not days, to have the surgery, and then there's a recovery time at home. Minimally invasive surgery removes all of that, or the vast majority of it, and it's a much more acceptable form of treatment for many patients. But the key here is that we must maintain effectiveness, so the operation still has to work, and of course we always have to be safe. So this is something that I've been helping to pioneer in my hospital on the NHS. That's UCLH, and the Royal National Ear, Nose and Throat. And I'm now part of various working groups and attending various symposiums to discuss the benefits of minimally invasive awake surgery. And nowadays, everyone's also very mindful of both the financial pressures on the NHS, but also sustainability. Using an operating theatre is one of the most carbon heavy industries in the world, and certainly within the NHS, operating theatres are a huge contributor to the carbon footprint. So if we can reduce that even to a small degree, it can have a big effect. A minimally invasive surgery, it reduces the number of instruments used. It reduces the waste. It removes the need for any anesthetic gases, which are quite bad for the environment. And so it's a very green way of operating on patients. So we're trying to expand the range of what we can do. So we also have balloon sinus surgery, where we can open up sinuses using this specially made balloon. And sometimes I'll do what's called a septoplasty, so straightening someone's deviated septum inside their nose. If it's not a very severe deviation, it can also be done under local anesthetic. So it's a fast, effective way of managing many of my patients. So minimally invasive surgery in my department it's carried out in an area we call the procedure zone. So patients they come in to a receiving area where they're checked over by a nurse and an initial blood pressure and pulse is taken and some basic check-in questions are asked. I then meet the patient, go through the procedure, make sure that they have informed consent for the procedure that we are about to perform. Once the patient then goes into the actual procedure room, I will first of all spray the nose with local anesthetic and decongestant spray. This takes the edge off the feeling in the nose and opens the nose up a little bit. And then I'll move on to actually injecting some local anesthetic using a very fine needle, and I inject into the area where I'm going to be operating. I describe it to patients a little bit like a dental type injection, which many people have had, and that gives them an understanding of what they're going to experience. The patient can't see what I'm doing because it's all inside their nose. So I always make sure that I talk them through the whole procedure, explaining what I'm about to do, make sure they don't suddenly get a shock, which of course would be very unnerving, and try to keep them calm. Sometimes we play some music in the background, which helps the general mood. We lower the lights and make it as calm an environment as possible. So the procedures of various different types rarely take longer than about 45 minutes, because also if you're awake, you don't want to be lying there for too long. So my job is to plan my procedures so that it takes all this into account. So and once the procedure is done, with or without sedation, then the patient will go back to the receiving area. The nurses will check them over again, do another pulse and a blood pressure, and usually within about half an hour, the patient is ready to go home. So they've only been in the hospital for a very short period of time. We design the visit a little bit like an outpatient appointment. So they have a set time, they come in, have the procedure, make sure they're okay, and then they go home. It's very important if they have had sedation that they need someone to be with them to escort them home, because it's dangerous to go home alone. But apart from that, they can go home, rest for a bit, and many patients can be back to normal by the next day. Now, anyone that's had an operation in a normal operating theatre and certainly under general anaesthetic will know that it's a very different feeling. It's a different process. Everything takes much longer, and there is the risk of a general anaesthetic. So it avoids all of that aspect, and we're able to do a lot now under these minimally invasive conditions, and it saves the patient a lot of time. It saves the NHS money. It's great for patients, and it also helps with the environment as well. So there are an increasing number of conditions which we can manage. Nasal blockage caused by inferior turbinate hypertrophy. So that's any form of inflammation in the nose, whether it's allergic or not, that doesn't respond to standard treatment, can be treated, and this is very commonly done by myself, in a minimally invasive setting, using different techniques to shrink the lining of the nose. And this is very quick, simple, and this can be very good. At the same time, some patients also have a deviation of their nasal septum, the partition in the nose. So if a patient says to me that although both sides of my nose are blocked by this lining swelling, one side is always that bit worse, and that fits with a deviated septum, then I will often straighten the septum at the same time, as long as it's not too deformed. And this further adds to the improvement in the nasal airflow. The other group of conditions, the main conditions that I treat by this technique are sinusitis. It's very important that the patient comes to me and is referred to me relatively early on in their journey through in their symptoms of sinusitis. If the sinusitis has been going on for many, many years and they've been suffering for a long time, then sometimes that means it's beyond the scope of what a minimally invasive procedure is able to help with. So I'm actively now involved in a project to try to set up a protocol and a referral pathway where GPs will hopefully send the patients to us earlier in this process. And then patients with sinusitis can be treated with minimally invasive techniques such as the balloon sinuplasty to expand the drainage pathway of the sinuses, washing out the sinuses. So if somebody has an infection in there, we can open the sinus up with the balloon or with more traditional techniques, wash out the sinus, get rid of the infection, and then they feel much better. Removing polyps, again, that's an element of sinusitis, so we can shave back the polyps very effectively under local anesthetic. We've also, in a different video, talked about the Clarifix device, which helps treat patients whose noses drip a lot. This is a minimally invasive procedure. The message is there's a lot more that we can do. Years ago, we would have said many of these procedures require a general anesthetic. Well, that's no longer the case. It's about having an open mind, maintaining quality, though, and safety. So the recovery period from minimally invasive surgery does depend on the actual procedure performed, but for the vast majority of patients, within a few days, they are able to function completely normally again. And hopefully they are already starting to feel the benefits, although I always warn patients that it can take a few weeks for the benefits to really start to be felt because of irritation in the nose caused by the procedure. So the downtime is minimal. And just to put it into context, I tend to do most of my minimally invasive surgery on a Thursday. I normally tell the patients to have the Friday off, and certainly then after the weekend, they're fine to go back to work. But if they had to work on the Saturday or Sunday, they'd probably be fine. So yes, one has to be realistic, and sometimes that's not the case, but minimal downtime. In terms of risks, so the one thing that we worry about is bleeding. That's the main concern. Interestingly, certainly with sinus surgery and polyp surgery, bleeding during the operation has been shown to be less in patients who are awake when having their surgery than those who are under anesthetic, which is perhaps counterintuitive to many of us surgeons because anesthetized patients usually have a lower blood pressure and a lower pulse rate, but the awake patient actually bleeds less. And then post-operatively, it is very rare, but there is a risk of bleeding. But again, it's actually a lower risk than patients who have a general anesthetic. And that's partly because often more is done under general anesthetic. So I always give patients advice on what to expect, not to do too much extreme or severe exertion, because that puts them at risk of bleeding. I give them treatments to use inside the nose, such as salt water washes and antibiotic creams to help things to settle down, taking painkillers if necessary. And most patients are absolutely fine. So all my patients, pretty much without exception, I would want them to have had non-surgical medical treatment first before considering any form of surgery. And that for the nose usually is in the form of nasal sprays, usually a steroid, antihistamines if we think there's allergy related, saline washes, nasal douching as we call it. And all of these can be very effective for many patients. And I would usually want my patients to be on these for about 3 months. If symptoms are not improved after 3 months, then that puts them in the bracket of chronic sinusitis or whatever other condition it is. And they are not responding to medication. And therefore, I would consider something else. Now, for some patients, that would be different medication or stronger medication. But for many patients, that would then put them in the bracket of requiring some form of procedure. And if we catch them relatively early, then minimally invasive surgery is an option. As with any form of medical treatment, it's about doing appropriate investigations, appropriate initial management, and then moving on to an operation, whether minimally invasive or not, as necessary.